welcome in Paris, welcome in MCAS. Thanks, chairpersons. Talk today about acne and acne scars. We do post-acne scars, how to do lasers. We usually use ablative lasers, but what about non-ablative lasers, co-switched NdYAG and long-pulsed NdYAG? Me, Khalid Gharib, assistant professor of dermatology in Zagazig University of in Egypt, with my colleagues Sayed Khater and Sahar Abdesattar. We know that acne scars is prevalent, is highly, about 95%, which is caused by inflammations of the dermal layer of the skin. We know that the scar is created by this abnormal inflammations following abnormal healing of the lesion of the skin. So a scar was usually not only with severe acne scar, but can with mild and moderate acne scar. So we should see the familial. If the female come to you with acne scars and choose the mother, choose the fathers, if they has familial acne scars, you usually decide to early treatment and how to prevention of acne scars before you decide to treatment of the acne scars. So classification of acne scar usually based on how abnormal healing of the dermal inflammation, either excessive collagens with hypertrophied or depression of collagens with loss of the collagen with atrophic acne scars. So the pathophysiology of acne scar usually due to over-inflammatory process in the fibroblast or skin wound tensions or abnormal collagen depositions, or there is inflammations and production for the keloid. So when we assessment of the lesions of the acne scar, we should, is this macular scars, there is mild or moderate or severe atrophic or hypertrophic scar, but is a concern today about the atrophic scar. When we say atrophic scar, you should say about what type of atrophic scar, maybe rolling scars, maybe ice pick scars, maybe box scars, or maybe tasselled anchoring scars. So we have different types of the atrophic scars, not only keloid, not only hypertrophic, but only atrophic scars. When we talk about atrophic scar, maybe ice pick scars, less than 2 millimeters, rolling scar from 4 to 5 millimeter depths, box scar from 1 and 4, and one of the most difficult type of the treatment is box scar. But we should decide that rolling scar, one of the main treatment is subcisions, either knocker needles or subcision what you have. But there's examples of the rolling scars. Subcision is very important types. Maybe box scars which have difficult type of the treatment, and tasering rolling scars. Another examples with the patient with rolling scars, you should decide what does type of the scar before you start the treatment, or box or ice pick scars. So it is very challenging for the dermatologist and for the patient not to treatment of the acne itself, but treating of the acne scars, because how to prevent the acne scars, how to treatment of the acne scar, what is the percentage of satisfaction for the patients and for the dermatologist for the acne scars. So we have different modalities in the treatment, in the clinic, in the hospitals for the treatment of the acne scars. Maybe need some chemical peeling. Even we starting with systemic treatment, we do chemical peeling to prevention of occurring of the acne scars. Some surgical excisions for plastic surgeons, punch, grafting, dermabrasions, even with injections of the fillers of the nanofat and what others. But what about if all of these techniques not confident with us? Because of incomplete scar removal, because of transmission of infections with different techniques, because of maybe the scar worsening with typical or pointed or cross technique of TCA, or tissue fibrosis, or permanent pigmentary alternation. So we decide what about the lasers for the treatment of the acne scars. Know that the lasers may be ablative lasers, different carbon dioxide, erbium lasers, ablative lasers, or non-ablative lasers. The mechanism of actions of non-ablative lasers usually stimulating the fibroblast to replace the dermal inflammations and of collagen and the fibroblast, so we can fill and full the defect in the acne of the atrophic type of the scar. So we have decided idea now to evaluate the efficacy and the safety of the long-term effect of long-pulsed and co-switched NdYAG, how to treatment is efficient, can be used, can be replaced, the ablative lasers, what we can think. We have 25 patients selected in outpatient clinic the age usually with acne increasing is over the 18 years. Usually this is collection time between 2019 March to December in Egypt. So we decide on the face, we have a split face technique. On the right side, we do long pulsed NdYAG, long pulsed NdYAG 1964, and on the left side, we do Q-switched NdYAG. We try to do the same parameter but different between the long pulse and Q-switched because the side effect is so 14 joule per square centimeter and 1 millimeter density on the right side, and the left side 3.4 joule per square centimeter and 6 millimeter density. We saw some side effects or some response of each long pulsed NdYAG and Q-switched NdYAG, which is good in 14 patients on the right side, and on left side there is 5 patients or different parameters. But what about the side effects and what type of the treatment we could do to side effects? We find that inflammations and bleeding was more with long pulsed NdYAG, 25% more of the patient. I think that we know that maybe inflammation is common, bleeding, but we find more side effects with Q-switched NdYAG. This hyperpigmentation and edema could be found. Yes, we do in the scars and the acne scars itself. So we decide of some patient, example of some patient, we're 37 age. On the right side, we say that long pulsed NdYAG. On the left side, with Q-switched. Because this equation is difficult, because we have the skin is fits pattern on our skin usually 4th and 5th, because inflammation is more common and the side effect on common. I'm not talking on the Fitzpatrick with type 1 and type 2. Okay. Yes. So we decide the different type of the atrophic scars. We decide each treatment and showing the good result more on the right side more than the left side. So the long pulsed with minimal side effects and give some good results, but not the so or not excellent and not proving left side. This is another patient of 20 years old with also on the right side was long pulsed NdYAG and also on the left side on the split face with Q-switched lasers, and the side every side of the treatment is either ice pick, either box scar, is tethering ruling, what other the type of the ruling scars, and showing also the treatment with minimal side effects and some good results on the right side of the face.
1 minute to go.
Okay, I'm finished. So, Q-switched lasers, either long pulsed or Q-switched lasers, considered and some effective in some time of the treatment, especially in Fitzpatrick 4 and 3 and 5 treatment of boxed acne scar, especially in old age patient, type 4 I said before, so no downtime or minimal downtime as other procedures, so not disturb with the daily activity, but some transit side effects are self-limited and low incidence. So when we preferring Q-switched and long pulsed, I prefer long pulsed because of side effects according to the type 4 treatment. Thank you.
Thank you very much. So for a matter of time, we are continuing to the next presentation.